should even address this problem to the restaurant owners, to the vendors of the tea on the roadside, that whenever a person is asking for a sugar-free, he should be told that you should get your eyes checked up. Wherever the chemist is being demanded for the anti-diabetic drugs, he should give him his handout that eyes need to be checked. You can go blind.
So I've seen you working very hard during my fellowship time. You almost used to wake up almost at 4:30 in the morning, send correspondences, and after that go for a swim, come back to the hospital, start your rounds, then the operations and OPD. How did you find time to do research?
Our research, Dr. Kelkar, has been in keeping the records and addressing the statistics primarily. Even basically that didn't exist in our systems as such all over the country. You have to record every finding, you have to create your own statistics out of it and compare it with the benchmarks existing. And today more so, with the internet available, you can always compare your benchmark with the other immediately, whether I'm doing to the same level as well as the other people are doing. And so I would recommend that an average person should do clinical research in the form of creating his statistics, in the form of community help, and if possible, if he has access to it, he should involve in other trials as well.
So what motivates you to work so hard? Every day you work very hard. You always come to Pune to see a few patients. You have been going to Nigeria, you have been going to Yemen and some places like Chikodra where you have set up a charitable retina centers. What motivates you to do all this?
One of my fellows, after he finished with us, went back to his practice and sent me a card, greeting card, with a note that, "Sir, I saw this card and I thought of you and I'm sending it to you." That card read, "If you love your work, you would not have worked at all. You would only have loved." And teaching has been a passion from the time when I was a registrar. Improving the methodologies of teaching somehow was inculcated in the early phases, and we finally got the appreciation with the definition of a good teacher applied upon. A definition of a good teacher is that it's he who knows that the student wants to, is like the saying which is printed in the Wright's book of physiology, which we used to read. More than what the calf wants to suckle, the calf wants to suck, the cow wants to suckle. More than what the child wants to feed on the breast, the mother wants to feed him. The teacher is also like that. More than what the students want to learn, you want to teach them. This is what we have learned and we practiced.
So now a new team is taking over the Retina Foundation under the leadership of Dr. Manish Nagpal. What are your thoughts? How do you feel?
They have taken over. They have not given me any time to think. And I'm happy and proud.
Yeah.
And I look at these students like you and feel happy and proud. And
Thanks.
try to mention it to the others. Improvements in medical science, Dr. Kelkar, are primarily related to number one, making the diagnosis earlier, and number two, making the interventional procedures, especially as atraumatic, more atraumatic as possible. The fundamental principle of the surgery is that if you can correct a thing with a needle, don't use a knife. And if you can do the treatment with a drug, don't use a needle. So to reduce the trauma in surgery, you can see we were doing surgery with a large incision, with intracapsular. Gradually we came down to extracapsular, we made the incision smaller. We used the microscope to see better, cut only what is required. And thereby we could combine these surgeries and have the same extent of trauma. After all, when you fall ill and you need surgery, you choose the senior most surgeon. Have you ever thought, why do we choose? Because he cuts the least and still achieves a traumatic part between each. So we want to make, somebody has philosophically said, we're looking forward to the day when the surgeons will not have hand. Surgery is trauma. If only you could ask the limbal cells which you cut, corneal cells which you cut to make a tunnel to reach the lens for removal. Those cells are telling, what have we done? Why should we suffer? In the same way, we want to reduce that trauma. So, interventional techniques, trauma to be reduced, and it will continue as it has happened in the past. We may one day come to the level of cellular surgeries, but it will need early diagnosis. Diagnosis of a disease has 4 stages. Development of a disease. It starts at the functional level of the cell. It becomes at the level of the tissue, the hardware of the cell affected, a group of cell affected, and the whole organ affected. This is how it moves. Unfortunately, most of the diseases we are able to see when the whole organ is affected. We have to diagnose the condition when the first terrorist started that job of transforming the minds of the other people and creating a disease. Number of instruments are coming up to detect the autofluorescence in the fundus and predict whether he will get ARMD or not. Number of genetic investigations are able to predict that this lady will develop breast carcinoma. So, newer and newer techniques, instruments, there is a camera which can take the picture, and the change in the fluorescence tells that this diabetic patient will develop retinopathy in the next 2 years. So increase your follow-up. So the future I see is becoming more and more non-interventional so far as surgical disciplines are concerned. And just like the OCT, without cutting the eye, you are able to get, or the SLO telling you the vision exactly. Those things will mature themselves. And it's happening.
Coming to the last section of our interview, it's called as a rapid fire round. I'm going to ask you some 5 questions if you can answer them quickly. So the first section is, where does the future lie? The retina surgeons, men or women?
Retina surgeon would be men now.
And the lasers or pharmacotherapy?
Retinas would be women.
And the lasers or pharmacotherapy?
It would be more and more of pharmacotherapy.
And more ophthalmologists will choose to do phaco's or vitrectomies?
I think still there would be more phaco's.
And the group practice or solo practice?
Group practices are the natural consequence. There is no escape from it.
And the future practice will be ethical or it will be profit driven?
It will be profit driven, but it can still combine with ethical.
Okay. So it was indeed a great pleasure talking to you, Dr. Nagpal sir. It's always inspiring.
Equally a pleasure.
What is your take home message to all the upcoming ophthalmologists?
Work hard.
Okay.
Nobody will escape from that.
Thank you. Thank you.
And keep the interest of the patient foremost.
Yes. Thank you so much, sir. It's always a pleasure talking to you and often inspiring.
It's the same.
Okay. Thank you, sir.
Thank you very much.
Thank you very much. Thank you.
That's been a great learning.